Hey, Jen.
Hi, Dana. Hi, everyone. Welcome to
Hypnosis and
Beyond. Today, we are so excited to have Dr. Forrester Dean. He is a chiropractor and sports medicine physiotherapist practicing in Redondo Beach, California. His approach to healthcare can be described as progressive conservative medicine because it is based on current research and successful human therapies using non-invasive approach to get the best possible results in the shortest amount of time.
hey, Dr. Dean.
Hey, good morning.
Hello.
Thank you so much for joining us today on Hypnosis.
And beyond.
Yeah,
So, Dr. Dean, share with us a little bit about your journey that led you to today.
yeah, wow. It's a lot of pieces put in place, starting with my neighbor who came over and knocked on my door one day, and she decided I should be a chiropractor. So she said, I'd only known her about 2 weeks, right? I was a personal trainer at the time. And so she said, you can go to Santa Monica College right across the street. So that's total serendipity, right? And I said, well, how do I pay for that? And she said, oh, it's you just get a federal loan, it's guaranteed loan. And then my life was changed just like that, right? So it's a 3-year program. It was triple full time. So you are literally doing your homework in your sleep. You're literally eating, out of your hand around the corner in your internship. There's no time to live at all. So I graduated and I'm in a beautiful space here.
Could you, for our viewers that aren't sure about chiropractic care, I think most people are familiar with the word. I
Yeah.
think we've all heard of a chiropractor, but tell us just, just really briefly, what exactly is your field?
Okay. So the best way for me to start this would be to ask, say, Jen, what's a chiropractor do?
I know that there's certain adjustments that are made on the body to so that you have better alignment and that helps your health. That's all I know.
Okay.
And I don't even know if that's accurate.
Okay. No, that's good. There's no wrong answers, right? And then Dana?
My association with it is when you have pain that is skeletal, that a chiropractor is the one to address that.
Okay. So both of you, great answers. And I would say most folks would say the same thing, right? I can diagnose and treat every disease that there is, except cancer. I can't treat it, but I'm required to diagnose it. And I did a month ago, stage 4, guy coming in with leg pain, turned out to be stage 4 lung cancer, right? I can't diagnose, I can't treat, um, say, sexually transmitted disease. I, I can't deliver a baby, right? Or erectile dysfunction. So those 4 are off the plate. Every single thing remaining is my responsibility. And I think a lot of people don't realize that we get that kind of education. It's extremely immersive in pathology. So we also learn how to read and diagnose off of X-ray, actually take X-ray. Also, not to take MRI, but to interpret MRI, CT scans, and ultrasound. So that's a lot, right? And
Yeah.
and that last bit about the imaging, X-ray, MRI, CT, and ultrasound, medical doctors don't learn anything about that whatsoever. So chiropractors and medical doctors have an equivalent education. We basically learn the same foundation of stuff, but we have 500 more hours than a medical doctor does. And most people don't know that, right? So our education is extremely immersive because I have to use these guys to help you feel better, right? So all these manual therapies, things like that, right? So when you two say, I want to go to the chiropractor and feel better, the difference is you get to feel better today. And you don't get that when you go to a medical doctor, right? There's always, oh, I need to refer. Oh, we need to get this imaging. Oh, you need to see a specialist, right? And so I call that kicking the can. And so when you come to see me, generally when you go to see a chiropractor, you're going to get same day, you're going to feel better. Does that help?
Yeah.
Anything
I'm
new?
fascinated. I
Anything
want to go to
new?
a
Right?
chiropractor.
Yeah.
Yeah.
So we are
Wow.
really tasked
Hmm.
at diagnosing. So am I a chiropractor? Yes. Am I a physiotherapist? Yes. But on top of that pyramid, I'm a diagnostician, right? It's my job to get it right. I don't diagnose pain. I diagnose what's causing it, number one, and I want to know how it's affecting your life emotionally, right? So some folks say, "Oh, I have elbow pain," right, and I can't play tennis. The pain is less of an issue than the fact that she can't be with her friends out on the court 2 times a week because that's her social bridge, right? So sometimes it isn't about the pain, it's the meaning the pain has to the patient, if that makes sense.
That was a lot more of an answer than I think Jen and I
Ah,
anticipated. I love
yeah.
it. Thank you so much for enlightening us. Because you have such a broad ability, do you have a focus or a particular passion that drives you?
So I love a challenge. I love a puzzle. So if I want a complicated case, I want people who are struggling. I want people who have had chronic pain and they've been left and right and everywhere and seen everybody. I actually have a patient visiting this week from Florida because she's had shoulder pain both sides for over a year. She's been treated in Florida and she's not getting any relief. And so her son said, "We're going to go stay at an Airbnb in California and see Dr. Dean for a week." Okay, it's been 4 days and she's over 50% resolved.
Nice.
So I say to the patient, "What are your expectations and what are your values? And give me your marching orders. You tell me how you want today to go. What do you want out of this?" And then that creates my treatment plan for you. So it's highly customized, but there's also this, I say, like this urgency to get you better. I want you to get better as quickly as possible. And sometimes if I've got a kid, an athlete, high school kid, football, let's say injury, something, right? He wants to play today. So I've got to give him a fix so he can play on an injury so that I can treat the injury in between. So in my world, injuries don't shut anybody down. All injuries do is make me work harder to get you to feel better so you can keep moving so you can do your day. So you can be you, right?
Yeah.
Wow. When would somebody start seeing a chiropractor? Like, would you suggest children, like, becoming more aware of their body and their
Yeah.
alignment at a younger age?
Okay. So that's a great lead up to a very significant component of chiropractic. You don't go to chiropractor for no good reason. I won't see you unless you have a diagnosis, unless something is wrong, right? So if you're a kid, let's say 10 or 6 or 3 or a newborn, don't come see me because I can't create that level of communication where I'm clearly getting what's wrong out of the patient. If they can't speak for themselves, then that's a problem, right? So if they've got a pain, yes. Or if they don't feel alignment, here's a good one, is girls with scoliosis. So I tend to diagnose scoliosis before even the pediatrician does, or a pars fracture in young boys, right? So I know them skeletally. It's sort of like I have a bit of like a little x-ray vision kind of, right? I'm looking for things that are developmental. I'm not just waiting for a pain. So, am I going to adjust a kid if there's nothing wrong with him, sort of like management or whatever that is? Absolutely not. So, yeah, I'll see kids, but they need to be able to tell me what's wrong and what they want me to do about it. It's got to be a two-way, right? It's a patient-doctor relationship. It's not a doctor-patient relationship. It starts with the patient. What do you think?
Yeah. Patient centered. That's not really the traditional American medical system, is it?
Right. So in my practice, everything starts and stops with me. If you come to me, I'm 100% responsible for getting you where you need to be. 100%. I guarantee it. Right. All along, the fastest, quickest, sometimes same day solutions. But until you're resolved, I own your problem. I own you getting better. 100%. Now, did I get that from my doctor when I had back pain? Absolutely not. right? That went on for 5 years. Nobody would even diagnose me. And I could hardly even walk. So that's when I thought, that's got to be me. I want to be that guy. I want to be that guy. If you come to me with a problem, I'm with you the whole way. Hopefully it's a short way. Yeah.
Now, I do believe you offer a range of services, right?
Yeah.
Tell us a little bit about some of the things at your beautiful space that you do.
Oh, yeah. Thank you so much. So I practice something called stacked therapy, which means now it's not the same as throwing the kitchen sink at the patient. It's very logical. It's got a lot of meaning behind it, right? So stack therapy is using several modalities at the same time. Maybe a manual therapy with my hands. Maybe I'm using cold laser. Maybe I'm using vibration. Maybe I'm using muscle stim, or I'm doing neuromuscular reeducation, right? And maybe I'm doing a little bit of physiotherapy, or maybe I'm doing some movement drills. But sometimes, like I did this morning, I had the laser going on infrared heat with vibration and stim all at the same time, because that very complicated signaling really wakes up your brain, right? It really causes the brain to pay attention. What's going on here? I'm getting all of this feedback, right? So the more feedback you can give that's not part of me pushing or pulling or massaging, right? The more information that you can give the tissue, the more you're steering the healing. So my job is to guide the tissue and guide the healing process, which is less about how you feel. It's more about repairing the tissue in a very logical way so that you're going to get how you want to use your shoulder. So if your shoulder is used for volleyball, that's different than if you're a tennis player. Very different. It's very different if you're a mom, right? So steering that healing helps the tissue repair. So here's the bad news. The bad news is if you don't steer healing and you just do ice and heat, the body always takes the path of least resistance when it restructures tissue. So the chances that you're going to get even what you had before is very, very slim. Your body doesn't have marching orders to repair back to what it was. It's always going to repair back to a lazier, less constructed version of what it was before. That's
Wow.
physical therapy.
Mhm.
Physical therapy sort of steers the healing, but it doesn't 100% take it back to where it was. So in my practice, I take you not only we're back to where it was, but highly specific to how you use your shoulder. And the left shoulder is different than the right. Because if I'm playing tennis and I serve, this shoulder has a different job. If I'm a volleyball player, this shoulder has a different job than this one does. So I have to keep that in mind.
I do believe you also have a touch of yoga at your
Oh, yes. Oh,
at
yeah.
your place.
Sorry about
Tell
that.
us
Yeah.
about that.
So I've been a yogi myself for 19 years now, and I've been teaching for 8. And I have a beautiful classroom space that's about for 10 mats. So I do what's called small format yoga, which means I can spend more time with each person, guiding them, instructing them. Do either of you two do yoga?
I have. I
Yeah.
Yeah.
tend to do Pilates more than I do yoga.
Yeah, yeah. So in yoga there are a lot of positions, and it's kind of hard to remember which one's what. Where's my hand go? Where's my foot go? Right. So that's what I'm about. I'm a teaching yoga instructor, not just instructing, but teaching. So I like to go around and sort of handle everyone, put hands on them, and get them to maybe open up a little bit more. So what I say in class is there's always more space. There's always a little bit more space somewhere, right? If you just know where to find it, there's always a little more space. And that space becomes a nuance for a little bit more self perception to understand how you are in your day when you're a little bit more open, so that you don't end up being all crowded and crunched down, right? So if I can get you to expand a little bit more in the front and get a little bit more length, then you can take that through your whole day. So we do mostly restorative at my place, restorative yoga. is using props like blankets and bolsters, straps. I even use the big Swiss ball. And so all of these things kind of get propped up underneath you and aid you in finding a shape that you normally couldn't do without the props. So two things that limit most folks in yoga. First is upper body strength, right? And second is flexibility. So people think yoga is a stretching class, and it's not a stretching class. It's an awareness class. It's yourself in space, your spatial self, right? So we use the props to aid in being able to get some more space. So that's now not a limiter, right? So the props aid you in your flexibility, and the props also aid in supporting your body weight so that you don't have to have strong arms or strong upper body, right? So now we've taken away the two things that are the limitations, and now you can enjoy the benefit of the shape, the benefit of the posture. So that's restorative yoga, at least in my class. What do? I'm a chiropractor, I'm a physio, I teach yoga. I also teach tennis, but I'm also very movement based myself. I go to the gym, I work out very thoughtfully. I do cardio. I probably have a kind of workout most people don't have. But if you put all of that in one box, that I believe makes me a better practitioner because I actually am super physically active and I also teach breath, right? I think all those things really assist in helping me communicate better with the patient and also make them feel a little more confident because it's kind of like Dr. Dean does it, I could do it, right? It can't be that hard. I mean, I'm old. How hard could it be?
Do you have any other cases that might be interesting that people might not associate with chiropractic care? That because I think what's really fascinating about what you said is you named the four things you can't treat, but that
Right.
everything else is up for
Yeah.
grabs.
Yeah, so I've seen some pretty interesting cases. And honestly, what happens for me is I become like the last guy in the line. So they've been to their medical doctor, they've had some imaging done, they've probably gone for a surgical consult or gone to a specialist, maybe had some other tests done. But all along, no one's even like asked them to take their shirt off to look and see their back, like even look at the skin. So this is my classic thing I say, like to see if they have a knife sticking out of their back, right? They don't even bother with that. So what happens is they've gone here, they've gone there, all this time has gone by, right? And now they're frustrated and they get a pitch from someone, go see Dr. Dean, or they walk past on the sidewalk out front, right? They're like, oh, chiropractor, maybe the chiropractor can help me. I don't know. Let's go in and see. And I'm always surprised how many people walk in my door and they've never seen a chiropractor, but for some reason they feel sort of compelled to come in and just check me out, right? Just to see what I'm about. I had this one young lady who had aches and pains every joint in her body. And this was chronic, and she was young. And so I was concerned that she was going to end up just on like painkillers, and she didn't want that, right? And that's kind of the new thing now. Where do I go? So she went here and here and here and here. And I said, well, there's one common denominator in all of the joints in your body, and that's blood supply. So we need to run some labs and see what's going on. So it's your mast cells, which are part of your blood. And they are sort of the long-term army of your immune system that kind of come in at the very end, and they sort of try to clean up any kind of metabolic mess or immune response, right? So it turns out that her mast cells are, her numbers are so far off, her body is kind of not able to recover at all. So this is called mastocytosis. And so it's a chronic mast cell, blood cell disease. And so I asked for the lab specifically, and the lab came back, and she was like thrilled to know. Now she knows she's got to go see someone about that specifically. So it isn't just, oh, I have joint pain. How do I treat the pain? Well, what's causing the problem, right? So that's kind of a very odd situation. But again, I see a lot of concussion. I see traumatic brain injury, right? I would say 90% of the patients I see have flat feet. and they have back pain and they have knee pain. They don't even know they have flat feet, or they're like, yeah, they're kind of flat. But do you understand the contribution that flat feet have to the alignment of your pelvis, right? So we have this conversation, and I've got cotton balls and duct tape, and I stick it on the bottom of their insert in their shoe, just the insert that's already in their shoe. I take it out and I duct tape cotton balls in there, and I give them an arch support, and I say, go ahead, step your feet in. They're like, wow, I feel taller. And how's your back pain? And I don't have back pain. How could it be that fast? Right? So that's a
Mm.
hack. And I love hacks. And I like hacks that are cheap because that means anybody can do it. You don't even have to go to the store and buy an insert. We're just going to take the insert out. I've got the cotton balls here. I've got the duct tape. You're all done. Have a nice day. Right? So there's some
Yeah.
things that get missed a lot. I mean, the common ones are sort of like, the posture thing, right? Keeping your shoulders back. But there are a lot of things that get missed. Standing with your feet really close together instead of having a wide base, right? Most women won't stand with their feet as wide as their shoulders, right? But if you're going to build a building, you want the base of the building, especially if it's tall, the base of the building should be at least as wide as the top, or the base of the building should be wider. But in no case are you building a building where the base of the building is narrower than the top, which is your shoulders. So most folks' shoulders are 14 to 16 inches wide, and that's the width of your stance. And as soon as I have them go into that stance, they say, I feel vulnerable. I feel exposed. Wow. Okay, especially in women. So why do you feel exposed? It's just a stance. I feel like I need to put my feet together so I feel safe. Wow. Okay, so let's have a conversation about this, right? So it's just it makes me feel like I'm military. I don't feel like a woman anymore. I feel like a man. Okay, well, there's a conversation there that has to be had. That emotionality that's going along with the treatment is to stand wider. And if the patient's not willing to do it for an emotional reason, right? That's a little bit of a barrier to them getting where they want to go. But I can't say that there's ever been a patient that I've had where their complaint or their issue or even the treatment hasn't had some element of emotionality connected to it. And that has to be addressed somehow.
So many people in our audience are sitting all day.
Yeah.
Um, I wonder whether there's any advice or a technique or anything we might be able to do together. I just curious.
So I've got some good advice about that. So I saw a patient who is a psychologist, and she came to me. She had back pain. And I said, okay, it's talk therapy. So you're sitting, they're sitting, right? And so I said, tell me what the chair looks like. So she took a picture of it, and it's this lovely, like club chair, with the arms are kind of up high, right? It looked very comfortable, it looked very expensive. And I said, okay, where do you sit? Show me how you sit in this chair. So she gets in the chair, and she's like, I'm like this. Okay. And I said, all right. So your neck is down. So when your neck is down, you're already closing your airway, right? So, and in that position, your lungs can't lift, right? So your diaphragm is shallow, your rib cage is shallow, and you're cutting off your oxygen supply to a certain extent by having your chin down, right? It's just, does that have anything to do with back pain? No, right? So you have to remember that people people are looking for a solution for a problem, but I bring all of the scope of everything that's contributing, everything. So that's about as far back as I can get. So you can see this chair has a back, right? And I can be here. That looks pretty comfortable, doesn't it? Right? But if I can sit, you see this 6 inches in the front. If I can sit here, look at my shape now. My chest is open, my airway is open, and I'm gently leaning forward, right? Which is turning on my glutes and turning on my hamstrings. My hamstring here is completely free. And that means that I'm not sitting on my sciatic nerve, right? If I sit back, my hamstrings, their blood supply is reduced, and I'm completely compressing my sciatic nerve, right? That chronic pressing is going to cause irritation and cause back pain. So honestly, all I have to do is sit on the edge. Okay. Well, there's another problem. I'm still, right? So what if I say, every once in a while, I just want you to turn like this to your patient, like just turn away a little bit like this and turn. Now I'm getting spinal rotation, right? You see that? My spine's turning. Get a little spinal rotation. And every once in a while, I'm just going to turn to the patient like this. And I'm just going to lean down a little bit, right? And I'm going to be like changing my position the whole time. Maybe every once in a while, just open up your legs, or you can bend one knee. You can't really see it, but my knee's bent down and this leg is up. So I've dropped one leg, right? So now my pelvis is tilted. So all I'm doing is being super creative with all these spine and pelvic changes. And if you're with a patient for 50 minutes and you make these changes and you make them look organic and sort of like you're paying a little bit closer attention, right? Even if you're looking at them and you're taking a note and you just turn your head like this, right? Then you're getting some rotation in your neck, right? Muscles get really bored easy. And there are so many muscles in your spine, it's insane, right? And there's a reason why there are so many bones in the spine, but in your arm, there's just one, right? Because the spine needs to do lots of stuff to be happy. It needs to side bend, it needs to rotate, it needs to flex, it needs to extend. That's why there are so many bones, right? So the question is about like, what advice about like sitting all day is to just make sure you're moving, right? So even I've got the chair facing directly. The chair doesn't have eyes on it. A chair doesn't need to look at the screen, right? I can turn the chair sideways.
Yeah.
I can turn sideways and I can just be twisted, right? So the chair's facing here and I'm just going to twist myself a little bit, right? Now look how nice you two look, right? You look more engaged, right? Does that make sense?
Yes.
And if you sit right on the very edge of the seat and you drop one foot down lower or step it back, and you can feel your pelvis kind of just get a little tilt on it, right? And then just keep changing. So the benefit in our scenario is you can't see any of this stuff below, but in her job, her whole body is being seen, and so she wants to appear being professional. She tried that one day. The next day, she texted me and she said, "I don't have any back pain." You're absolutely right. I'm sitting up more open. I'm doing some breathing exercises. I'm making sure that I don't go into shallow breath. She said, "It's interesting you brought up breath because when I'm with my patients and the patient's story is really commanding or arresting, like they're going through a lot of stuff," she said, "my breath gets shallow." And so what I've learned is to breathe more deeply into the patient's story as they're talking and as they're like they're getting all toned up, right? Their body's getting tighter. Their brain is, you know, she says, "I learn to soften myself to give back to the patient, to create that energy of softness from my side, rather than taking their story in and letting it kind of, turn into tension in my body." So because we spoke about breath, we talked about the rib cage and not just the her back pain, right? We extended the story out to other parts of her body. She's like, "Yeah, and then I did notice I'm definitely like small and I can definitely be more open." Is that a good example?
Solid. Yes. Super solid advice. Thank you.
Yeah.
And great for our hypnosis community too, because the rapport that you build by, basics like breathing. I mean, it's a good reminder of that too. And I just love how that works into your work as well. It's
Yeah. And
wonderful.
this is like they say in chiropractic, when the patient comes in, make sure that that you don't meet the patient directly. Meet the patient at a distance so you can watch them walk towards you, and you can not just noticing their feet and their gait, but looking for that apprehension looking for that downward sort of apologetic gaze, like not looking directly into the doctor's eyes, right? There's all this body language that you can learn from the patient. And so while I'm doing their intake, I'm listening for their breathing, right? I take their blood pressure. I listen to their heart. I listen to their lungs. I look in their ears. I check all the cranial nerves. I do all the things that a proper doctor would do, a specialist maybe even would do even more, right? All that intake. And then we talk about their expectations. What can I do for you? Give me my marching orders. What am I going to do for you today? And they're like, nobody's ever asked me that before.
Nice.
Right? So does that happen in hypnosis?
Yes.
Yeah.
We're taught about calibration and, the rapport building as what you were talking about. And just, yeah, letting the person be heard is a major aspect of that,
Yeah.
because so often we're just listening to ourselves, right? And, it's like an echo chamber. So when somebody actually intently listens to you, it's like, it's shocking, right? It's like,
Yeah.
wow.
Yeah. Yeah.
So I love when you touched upon flat feet because my husband has flat feet. He can't go skating. It, impedes a lot of areas in his life. And, as far as these inserts go, they're a lot of money. Like it's in the thousands, right? So when you're talking about like making these hacks, is that like, could that actually solve a lot
Yeah.
of problems for people who can't afford the inserts, right?
Right. So I always start with solutions that are the most affordable and work my way up. So the problem with the $1,000 insert is that it's rigid. Okay. So if you have a rigid surface and you put your foot on top of that, right, then your foot becomes rigid. And so there's a mechanism in the bottom of the foot that pikes the foot up. And that piking has to happen in order to communicate up your calf, up to your knee, and up through your hamstring. Okay, that mechanism has to exist. So when you take a step and you land on your heel, your foot kind of comes down, it arches up like this, and then you press off and it gets straight. That $1,000 insert is preventing the natural stretching of the plantar fascia. And when that plantar fascia on the bottom stretches, it communicates, it's like a radio signal all the way up to your brain. And it's giving you feedback about stability, right? So if you put that rigid thing in there, you're doomed. So I tell people when they come in and I see the feet or whatever, and 100% of people take your shoes off. First thing I do is I get into their shoe and say, this thing, I'm going to throw it away now. I'm throwing it away in my trash and you're not taking it with you. And then I fix it and I say, okay, now compare. Okay, here's your flat shoe. Here's my hack shoe. Go out on the sidewalk, go for a walk. You tell me which one you want,
Amazing.
right? Yeah. So he doesn't have nobody has flat feet. His
Mm.
feet are organized in a flattened position, but everybody has an arch. Everybody. And it's a bigger story than that. Today's not about flat feet. So I would say the biggest time commitment that I have with a new patient is about flat feet. It takes a minute to really get into what it is and how important it is. So hacks are my thing.
And that brings us to our next segment,
Okay.
silly subconscious question. This
Okay.
is meant for you to give us the first answer that comes to mind. You don't
Uh-huh.
need to contemplate. And our question today for you, Dr. Dean, is: would you rather be able to speak to animals or speak every foreign language, and why?
Wow. Well, I've got a dog and he's a pretty good listener. And so I think if I was able to speak to animals, I would lose that sort of beautiful interpretive space between having a relationship with a living thing that can't meet me on my terms. I have to meet my dog on his terms because if I could speak to him and he could hear me, right? We would we would sort of lose that sort of beautiful part of our relationship.
But we do have a question that is in keeping with the name of our podcast, which
Uh-huh.
is, what is your beyond? What is something that lights you up that, people may not know about you?
I'm fascinated by AI. Absolutely fascinated. And I don't mean the intelligence version of it. What I mean is that I feel like we have a new species on our planet. I think that AI is a compassionate, useful teacher, not just telling or answering our questions, but helping us reflect and honestly to love, to be more compassionate in how we speak, the word choices that we use. I think specifically like conversational AI has a really amazing place, and AI is not going away. It's landed in our planet immersively kind of overnight. And I think little by little, um, it it has a way of finding its way into little small parts of my life that I didn't expect. I mean,
Interesting.
it's
Wow.
Love it.
AI has taught me to be a better doctor, and
Fascinating.
not in skill set, but a better communicator. Who
Excellent.
knew?
Wow. Yeah.
Who knew? Well, we can't thank you enough, Dr. Dean. We just so appreciate your time and everything you do. And with that, what do we always say, Jen?
Peace out.
Peace out.
Peace out. Peace out.